The early supported discharge service for stroke was established. We started a pilot in January, and the aim was to take all those people from the local hospital, which is Dorset County Hospital, who were eligible to come out to have therapy within their home, to be able to bring them out earlier than they would have been, to get the same level of intensity of therapy that they would have had in the hospital.
I had my stroke in February, February the 8th this year, and I can't personally remember much about it. The only thing I remember was like as if a knuckle was at the side of my temple, but I didn't have any faintness or giddiness or anything like that.
When Tom came home, he had been in hospital for 9 weeks, but he was absolutely a prime candidate for early supported discharge. He had therapy coming into him at home, I think 5 times a day initially, and it reduced down to probably 2 or 3 times a day, of stroke skilled therapists and our support staff working on independence, personal care, making hot drinks, mobility, stairs, his cognitive presentation, so how he thinks and how he copes with making problem solving and information processing. And he had a significant neglect of his left-hand side, which made life very difficult. But he's meeting his goals, and he continues to meet his goals.
Well, by constant physio on my left hand and on my left arm, it's helped me. I mean, I couldn't have done that 6 weeks ago. No chance. I certainly couldn't have done that.
We've seen 31 people on the pilot, and all of them have really improved their functional skills at home, and generally there's been a very, very good patient feedback and carer feedback. It's been a really good project, and the evidence that we've seen is that patients are making a really significant recovery within that period of early supported discharge. The benefit for the patient isn't just for the patient, it's for the patient and their family. There's the reduced travel time to hospital, the reduced carer strain. The patient is able to practice their independence within a known environment.
One of the big benefits, I didn't have to keep going to the hospital, and also we could start living our life normally again, and he could have friends in, and you know, really start living our life again.
When I first came home, they said, "What would you really like to do, Tom?" I said, "Well, I'd like to be able to walk out to the garage and back." They thought I was mad. And walk around the block. Well, I managed to do both.
He has worked, and Val has worked so hard along with the therapy support team, and he's meeting his goals. He's independent in his personal care. He can make a cup of tea. He goes out and about with Val on the bus, and their lifestyle is certainly has a higher quality to it than I believe it would have done if he hadn't have had the therapy at home.